patient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient Podcast. I'm your host, Vic Sinise. Nice to have you on board. If you're checking us out for the first time, or maybe you've checked us out before and haven't subscribed, what are you waiting for? Then you can throw us a like if you have subscribed. So today on UroPatient, we're asking a question more patients are starting to consider. Is concierge medicine right for you? With rising healthcare costs, longer wait times, and limited access to providers, concierge medicine is gaining attention as an alternative. But is it really worth it? In this episode, I'm going to break it all down. What is concierge medicine? How much does it cost? What do you get for your money? And how could it change the way you access care? From same-day appointments to more personalized attention, I'm going to explore both the benefits and the trade-offs you need to know. So if you've ever felt rushed, frustrated, or disconnected from your healthcare provider, you're going to love today's episode. So let's get to it right away.
Hey everyone, and welcome. Today we're going to talk about something that's really shaking up the world of healthcare, a model that promises a completely different kind of relationship with your doctor. This is our deep dive into concierge medicine. So let me ask you this. Have you ever waited weeks, maybe even months, for a doctor's appointment? You finally get there, sit in a crowded waiting room, only to get, maybe 10 minutes of FaceTime before your doctor is already halfway out the door? Yeah, we've all been there. It's that frustration that's got a lot of people wondering if there's a better way. So here's our game plan for today. We'll start with why people are even looking for better care. Then we'll explain what this different model is all about, get into the nitty-gritty of costs and coverage, weigh the good against the bad, and finally, take a look at the bigger picture. Right, so as we just talked about, that feeling of being rushed is a huge issue in the traditional healthcare system. Doctors are often trying to manage thousands of patients, which naturally leads to super short visits and really long waits. This desire for more time, more personal attention, and a genuine connection with a doctor, that's exactly where this whole story begins. And this search for something better brings us to our main topic, concierge medicine. We're also going to touch on its close cousin, which is called direct primary care, so you can see how they stack up. So what exactly is concierge medicine? Well, at its core, it's a membership model. Think of it like this. You pay a fee, usually once a year, directly to your doctor's office. And in return for that fee, you get a premium, highly personalized level of service, and most importantly, way more direct access to your doctor. You might hear it called other names like boutique medicine or retainer-based care, but it all really boils down to that same core idea. Okay, this chart right here really tells the story. Take a look at the patient panel size. A typical doctor in a traditional practice might be juggling over 2,000 patients. That's a huge number. Now look at the concierge doctor. They have fewer than 300. And that is the secret sauce. It's what allows them to completely change the appointment length, going from just 10 or 15 minutes to over half an hour, sometimes even a full hour or more. You can also see where direct primary care, or DPC, fits in. It's kind of like a more affordable middle ground that has some of the same perks. All right, let's talk about the elephant in the room, shall we? What does this kind of VIP access actually cost? We're going to break down the numbers and, just as importantly, talk about how your health insurance fits into all of this. The price tag for concierge medicine can be, all over the map. We're talking a range that usually starts at a few $1,000s a year and can go way, way up into the tens of thousands for some of those really high-end executive-level services. So yeah, it's definitely a premium service and it comes with a premium price. But for people who want better access without that really steep cost, the direct primary care model offers a much more accessible option. We're talking somewhere in the neighborhood of $50 to $200 a month. DPC gives you a lot of the same great benefits, like longer appointments and smaller patient lists. It just typically operates outside of the insurance billing system for its services. Now, I need you to lean in for this part because it is, without a doubt, one of the most important things to understand. Let me be crystal clear. That membership fee you pay does not replace your health insurance. Not at all. It pays for that enhanced access and your doctor's time. You absolutely, 100% still need health insurance for emergencies, for visits to specialists, and for any hospital stays. And for anyone watching who's on Medicare, this is especially critical to know. Straight from Medicare.gov, Medicare will not cover these membership fees. That part is 100% out of your own pocket. You still need your Medicare plan for everything else, seeing specialists, going to the hospital, getting major procedures done. The fee is only for that personalized primary care relationship. So what we have here is a model that offers pretty incredible access, but it comes at a cost. And that means there are some pretty big trade-offs to think about. So let's take a fair and balanced look at both the pros and the cons. Okay, on the pro side, the benefits are really appealing, right? You get way more time with your doctor. You can often reach them 24/7 by phone or text. You can get same-day appointments, and there's a real focus on preventing problems before they start. But the cons are just as serious. That high cost is the biggest roadblock for most people. And like we've said, it doesn't cover all your medical needs, and you might not even be able to find a concierge doctor where you live. Plus, it brings up some bigger, tougher questions about fairness in healthcare. And this really gets to the heart of the ethical debate. Critics of the model argue that by creating a system where better, faster access is only available to people who can afford a premium fee, well, you risk creating a two-tiered system of healthcare. It's a model that could make healthcare inequality even worse and deepen those class divisions. It's a really central point of tension in this whole conversation. So keeping all of that in mind, let's kind of zoom out for a second. Is this just a tiny niche for the wealthy, or is this a sign of a much larger shift in how we think about healthcare? Well, the data shows this is way more than just a small trend. The market in the US is already worth over $8 billion, and it's set to grow by more than 10% every year. That kind of rapid growth is really being fueled by two things: patients who are demanding more personalized care, and doctors who are looking for a way out from the burnout they feel in the traditional system. All right, let's wrap this up with the key takeaways. If you remember anything from our chat today, make it these 4 points. First, concierge medicine offers you personalized access to a doctor in exchange for a fee. Second, and this is the big one, it's a supplement to, not a replacement for, your health insurance. Third, the costs are all over the place, from the more affordable DPC model to very expensive premium plans. And finally, it's a classic trade-off. You get some clear benefits, but it comes with some major cost barriers and serious ethical questions for the healthcare system as a whole. And that really leaves us with one last big question to think about. Is this model an innovative solution for both patients and doctors who are just fed up with a broken system? Or is it just a symptom of that broken system, a fancy workaround for those who can afford it that doesn't actually fix the underlying problems for everyone else? Honestly, the answer probably depends on who you ask. If this is a model you're thinking about, the best thing you can do is your homework and talk to a healthcare provider you trust. Thanks so much for watching.
Well, I hope you really enjoyed that episode. Let's talk a little bit about what's going to come up next week. So next week on UroPatient, we're taking a closer look at something that affects millions of people every day: bladder irritants. From that morning coffee to your favorite spicy foods, what you eat and drink can have a direct impact on urinary urgency, frequency, and discomfort. But which items are truly problematic and which ones get unfairly blamed? So in this episode, I'm going to break it down, the most common bladder irritants, explain how they affect the urinary system, and help you identify simple dietary changes that may improve symptoms and quality of life. So if you're dealing with an overactive bladder, urgency, or unexplained irritation, this is essential information you don't want to miss. So tune in next week to UroPatient and take control of your bladder health one choice at a time. All right, we look forward to seeing everybody next week on UroPatient Podcast.
From research updates to daily advice, Vic explains it all, simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.